Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at nakakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matiyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to vac up.
Rodrigo Duterte welcomed the arrival of Sinovac.
Dumami pa ang mga Pilipinong gustong magpabakuna.
Barangada ng COVID vaccination.
Yung food court na ito, open na rin bukas.
The whole community will be there.
Na nakatulong sa pagbaba ng mga kaso, ito ang bakuna.
The Philippine College of Physicians invites you to its 25th Mid-Year Convention, hosted by the Central Luzon chapter. In this era of integrating virtual and face-to-face methods, learn on how we can move forward without compromising our practice of medicine. Join us in the 25th Mid-Year Face-to-Face with limited Zoom link convention. Let us learn more practical approaches to relevant and diverse issues in internal medicine with a renewed perspective. Interesting topics await you. On November 18 to 19, 2022. Save the date. See you at the premier convention facility in Central Luzon, Subic Bay Freeport Zone at the Subic Bay Exhibition and Convention Center. Don't be left out. Register now. See you there.
Iba na kasi ang panahon ngayon. Pakiramdam mo, naglalakad kang pauwi ng hating gabi at kinakabahan ka. Yun bang kahit anong ingat mo, anytime, pwede kang matsyempuhan ng masasamang loob.
Tuwing lalabas ka ng bahay, ang dami mong iniisip na pwedeng mangyari. Para bang nasa gitna ka ng dilim. At nagdarasal ka na lang na sana may proprotekta sa'yo kung sakasakali.
Ang pandemya ay parang isang iskinita na kailangang daanan. Alam mong may nagtatago sa dilim, pero wala kang nakikita. Puno ka lagi ng pangamba. Pero may liwanag na naghihintay. May proteksyon laban sa COVID-19. May maaasahan kang backup. It's time to vac up. Oras na para magpa-COVID-19 vaccine booster for backup protection, control, and prevention. Para sa mga 5 taong gulang at pataas, eligible na kayo para sa first booster shot kung nakumpleto nyo na ang inyong vaccine primary series. If you are a senior citizen or a frontline health worker who is 18 years old or above and have completed your first booster, you are eligible for a second booster shot ayon sa Philippine Department of Health. Ang COVID-19 vaccine boosters ay nagbibigay ng karagdagang proteksyon na maaaring humina na ang bisa mula ng inyong huling vaccination. Booster shots are effective in helping prevent serious illness, hospitalization, and even death. So, stay up to date with your COVID-19 vaccination. Kasama na dito ang booster shots. Magtanong sa inyong doktor o barangay clinic kung ano ang naaangkop na COVID-19 vaccine at tamang panahon para sa inyo. Sabay-sabay nating lakbayin ang daang patungo sa malusog, malakas at magandang kinabukasan. Protect yourself and your loved ones. Help control and prevent the spread of COVID-19. It's time to back up.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall be the light and lead a path to wisdom. Our will to be our lives. To those in pain and suffering, we shall hear a call. With arms to care and comfort, compassion above all, to praise the brighter future, found in unity, the Trinity College of Physicians, we shall be, hand in hand, building a stronger nation. Peace in
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Umaga po sa inyo lahat. Ako po si Dr. Ginger Samonte, ang head ng committee ng PCP sa Media Forum and Lay Forum na nagbabati sa inyo ng magandang umaga. At ngayon na naman ay nandito kami upang maghatid ng isang very timely na napapanahong topic ukol sa sakit sa puso. Cardiovascular disease is one of the most common cause of death globally. An estimated 70 million of people die from cardiovascular disease, and coronary heart disease, stroke were the major cause of these deaths. Ngayon, magka-celebrate po sa buwan ng Setyembre ang World Heart Day at naisip ng PCP na ito ay ang tamang panahon upang ipamahagi sa ating mga kababayan, ang ating mga followers, ang importansya ng napakalaking problema ng pagkakamatay o pagkakasakit ng mga Pilipino mula sa cardiovascular disease. So itong araw na ito ang ating magiging talakayan. And to start the media forum, we would like to call in to give the opening remarks from our very hands-on President of the Philippine College of Physicians, very supportive si Ma'am, Dr. Diana Payawal.
Good morning to all our viewers, friends in the media, and to our resource speakers for today's Health Forum. Magandang umaga po sa inyong lahat at marami pong salamat sa pag-antabay nyo sa aming Health Forum for today. Today's Health Forum puts a spotlight on cardiovascular disease and its risk factor. Ngayong araw po ay tatalakayin natin ang mga sakit sa puso at ang mga risk factors na nagdudulot ng sakit sa puso. It remains to be the leading cause of death in our country. Ito po ay ang number 1 na cause ng magkamatay ng mga pasyente, ang sakit sa puso. It is important that we promote awareness of it and strengthen and prevention strategies to avoid any problems related to the heart. Ang ating DOH at saka ang World Health Organization have organized a series of advocacy events during the World Heart Day on September 29, and it includes a heart summit. This summit aims to intensify efforts among stakeholders, advocacy groups, and decision makers to intensify efforts towards eliminating the burden of cardiovascular disease and other non-communicable disease. The Philippine College of Physicians, for its part, will continuously advocate on a healthy lifestyle, modification of habits, and making health services responsive to the needs of the Filipino patients. Kami po sa Philippine College of Physicians ay nakikiisa sa adhikain ng ating Department of Health and World Health Organization sa pamamayagpag ng malusog ng pamumuhay. Ito po ay ang tamang pamamaraan ng pagkain, hindi pagsigarilyo, at of course, ang pag-exercise. I would like to thank our resource speaker for giving us their time and sharing their knowledge to us. This health forum will highlight the significance of heart health, and as healthcare providers, we have the obligation to inform and disseminate this to the public. Thank you once again for joining us this morning. Marami pong salamat sa pakikinig nyo sa amin. And we hope we can impart with you and share with you whatever information you have to gain today to your family, friends, and colleagues. Tayo po ay nakikiisa sa malusog na Pilipinas. Maraming salamat po.
Message is very clear, the importance of heart health. No, hindi naman kailangan ng may sakit ka muna sa puso bago natin to alagaan. Ito po yung ating purpose ng ating umagang pagtalakayan. So with the title of The Heart Essential, Impact on Cardiovascular Disease and How to Improve Your Health, I would like to introduce our speaker. Our speaker is Dr. Aileen Albania Tamargo. She is a fellow of the PCP and the fellow of the College of Cardiology. She took her internal medicine training in Manila Doctors Hospital, her subspecialty training in adult cardiology in the University of Santo Tomas, and had another subspecialty training in advanced echocardiography. She is a board-certified diplomate of the Philippine College of Physicians. She's also a specialty board of the adult cardiology and a certified board examiner. She took her certifying board exam for advanced echocardiology last September 2019. To talk more about the cardiac disease and the impact on our health, especially in our country, friends, let us all welcome Dr. Aileen Albania Tamargo.
So my name is Dr. thank you for inviting me to be the speaker for today's lay forum. Let me share my slides first. Okay, so can you see my slides?
Yes.
Okay, so good morning again to all the listeners for today. Thank you for spending some of your time to listen to this very important lecture. And this is entitled Heart Essentials, the Impact of Cardiovascular Diseases and How to Improve Heart Health. Again, I am Dr. Ellen Albania Tamargo, an internist cardiologist, and I am privileged to talk about a very relevant topic. And I hope at the end of this presentation, I will be able to impart to all of you how important the heart is, the impact of the cardiovascular diseases, how to prevent it, and most importantly, the steps on how to take care of the heart and the ladder to a healthier, fulfilling life. Okay, so let me start by telling all of you what are cardiovascular diseases and its impact. So cardiovascular diseases are the #1 cause of death globally, taking an estimated 17.9 million lives each year, and that is around 31% of all deaths worldwide. So CVDs are a group of disorders of the heart and the blood vessels, and this include the coronary heart disease, cerebrovascular disease, stroke, rheumatic heart disease, and other conditions. 4 out of the 5 cardiovascular deaths are due to heart attacks and strokes, and 1/3 of these deaths occur prematurely in people under 70 years of age. So this graph shows the top 10 leading causes of death in the Philippines. As you can see here, pinaghiwa-hiwalay nila yung cardiovascular diseases. So merong hypertension, diabetes, tuberculosis, pneumonia, stroke, cancer. But the #1 cause is ischemic heart disease o ang pagbabara ng ugat sa puso. So from 2009 to 2019, the trend did not change for ischemic heart disease and also for stroke. Hindi sila napalitan as the #1 and the #2 cause of death, unlike with other diseases that change through time. So to address this burden on healthcare systems around the world, an in-depth understanding is needed about the incidence and prevalence of cardiovascular risk factors and various forms of cardiovascular diseases in different countries and regions. So the World Health Organization data estimates that by 2030, researchers project that the non-communicable diseases will account for more than 3/4 of death worldwide. And cardiovascular disease alone will be responsible for more deaths in low-income countries, including the Philippines, than the infectious diseases, maternal and prenatal conditions, and nutritional disorders combined. So ang cardiovascular diseases is today the largest single contributor to global mortality and will continue to dominate mortality trends in the future. So the first question is, why should you take care of your heart? Gaano ba kahalaga ang puso natin? So the human heart is a finely tuned instrument that serves the whole body. It is a muscular organ around the size of a closed fist, and it sits in the chest slightly to the left of the center. So on average, the heart pumps 2,000 gallons of blood per day. So wala tong hinto, tuloy-tuloy. Dahil kapag huminto, napakadelikado at ganun ka-importante ang puso para mag-function ang ibang organs at parte ng katawan. So imagine the never-ending workload of the heart. It can perform for so long for so many people, but it can also fail because of risk factors such as age, heredity, poor diet, lack of exercise, and also smoking. So once the heart fails, there are different types of heart disease that can happen. So technically, cardiovascular disease covers issues related to the circulatory system, which includes heart disease, while heart disease defines specific issues and defects related to the heart. So these are the 6 types of heart disease. Number 1 is the coronary artery disease, which is the most common form of heart disease. So nangyayari ito kapag nagkakaroon ng pagsikip o pagbabara ng mga ugat sa puso. Na meron ding heart attack or yung tinatawag natin sa medical term na myocardial infarction. Unfortunately, for many people, a heart attack may be the first symptom of heart disease. A heart attack happens when the arteries leading to the heart become blocked, disrupting the blood flow. Next is the heart failure, or otherwise known as congestive heart failure. And this condition occurs when stiffness in the heart prevents the organ from pumping blood adequately through the body. We also have congenital heart disease or heart valvular disease. And it happens when any of the 4 valves in the heart don't open or close properly and interrupt blood flow. So kapag yung defect na yun sa valve happens at birth, then it is called congenital heart disease. Then we have the heart muscle, or ito yung tinatawag na cardiomyopathy. So usually ito yung mga sinasabi na sakit sa puso na lumalaki ang puso. And this condition can lead to heart failure. So kapag meron kang cardiomyopathy, ang problema dito is when the heart muscle becomes larger and stiffens, preventing it from pumping blood away from the heart. And lastly, we have the arrhythmias or the abnormal heart rhythms. And this condition causes a fluctuation in the heartbeat that happens while at rest. And if untreated, arrhythmias can also be life-threatening. Okay, so we already know that in the Philippines, as I have mentioned in the previous slide, ischemic heart disease is the #1 cause of death compared to other types of heart diseases. So ano yung nangyayari kapag meron tayong ischemic heart disease? So kung makikita nyo dito sa picture, on the left is the normal artery. Maluwag ang daanan ng dugo at walang bara. On the right shows narrowing of an artery. So kung makikita nyo, masikip na ang daanan ng dugo sa ugat ng puso dahil dito sa mga plaque deposits. Kaya nagdudulot ito ng pagbabara. At kung may bara, nagiging limited yung blood flow, ganun din yung oxygen na papunta sa myocardium o sa muscle ng puso. So ito rin yung tinatawag na coronary artery disease o pagbabara ng mga ugat sa puso. Now, what are the complications of heart disease? So #1 is heart failure. This can result from many forms of heart disease, including heart defects, cardiovascular disease, valvular heart disease, heart infections, or cardiomyopathy. Lahat sila ay pwedeng mapunta sa heart failure or hirap na ang puso na sa pag-pump ng dugo papunta sa buong katawan. Next complication is heart attack. We also have stroke, which is nangyayari kapag ang nagkakaroon naman ng mga bara ay yung mga arteries or mga ugat sa brain at hindi sa puso. Next is aneurysm, which is a serious complication that can occur anywhere in your body. And then aneurysm is a bulge in the wall of your artery. If an aneurysm bursts, you may face life-threatening internal bleeding. So napakadelikado din ng mga aneurysm. When you develop peripheral artery disease, your extremities, usually the legs, don't receive enough blood flow. So this causes symptoms, most notably the leg pain when walking or yung tinatawag na claudication. At ang pinaka nakakatakot sa lahat, ang sudden cardiac arrest, which is the sudden unexpected loss of heart function, breathing, and consciousness. The end is often caused by fatal arrhythmia. So if not treated immediately, it results in sudden cardiac death. So nabanggit ko na ang lahat ng mga maaaring maging sakit sa puso at mga complications. And although many people develop some form of cardiovascular disease as they get older, it isn't inevitable. Yan ang palagi kong sinasabi sa mga pasyente ko na ang heart disease, maaari natin itong iwasan with a healthy lifestyle, especially when started at a young age. Hindi natin dapat sabihin na, bata pa tayo, pwede pa tayong hindi mo na mag-control, hindi mo na mag-diet, hindi mo na maging healthy. At hindi din dahil matanda na, wala ng pag-asa. So lifestyle changes and medications can actually nip heart-harming trends like high blood pressure or high cholesterol before they can cause damage. Kaya dapat simulan na natin ngayon, and hopefully, in the next few slides, you will learn more and start following the steps to a healthier heart. So what can you do to improve your heart health? So these are the steps to a healthier heart, and I will be thoroughly discussing each. Okay, so number 1 is understand your risk. Bago natin malaman kung paano yung management na gagawin natin, all the lifestyle modification, dapat alam muna natin kung ano din yung risk natin. So palagi natin nadidinig yung salitang risk factor. Pag sinabing risk factor, ito ay ang mga kondisyon na maaaring makapagpataas ng ating chances na magkaroon ng isang particular na sakit. And sa bawat sakit, may iba't ibang risk factor. So sa ngayon, we will be focusing on the risk factors for heart disease. So first is the major risk factors that cannot be changed. So you may be born with certain risk factors na hindi na natin mababago, wala ka nang magagawa. And the more of these risk factors that you have, then the greater your chance of developing coronary heart disease. And since you cannot do anything about these risk factors, it's even more important that you manage the risk factors that can be changed. So ano-ano ba yung mga yon? Number 1 is the increasing age. Wala tayong magagawa sa ating pagtanda. Majority of the people who die of coronary heart disease are 65 years old or older. Next is the male gender, because men have a greater risk of heart attack than women do, and men have attacks earlier in life. And lastly is heredity, including the race, no? So children of parents with heart disease are more likely to develop heart disease themselves. So ang i-focus natin ngayon is yung major risk factors that you can modify, treat, or control. So number 1 is smoking. The risk that smokers will develop coronary heart disease is much higher than that for the non-smokers. Cigarette smoking is a powerful independent risk factor for sudden cardiac death in patients with coronary heart disease. And exposure to other people's smoke, so ito yung secondhand smoke, will also increase the risk of heart disease even for the non-smokers. Next is the high blood cholesterol, because as your blood cholesterol rises, so does your risk of coronary heart disease. Next is high blood pressure, because high BP increases the heart's workload, causing the heart muscle to thicken and become stiffer. And this stiffening of the heart muscle is not normal and causes the heart to function abnormally. So kapag meron kang mataas na presyon ng dugo, it also increases your risk of stroke, heart attack, kidney failure, hindi lang puso, and congestive heart failure. Next is physical inactivity, because an inactive lifestyle is a risk factor for coronary heart disease, obesity, and being overweight. So people who have excess body fat, especially kapag yung madaming taba doon sa tiyan, they are more likely to develop heart disease and stroke, even if those same people have no other risk factors. And there are also other factors that can contribute to heart disease, like your diabetes, This can seriously increase your risk of developing cardiovascular disease. And close to around 70% of people with diabetes over 65 years of age die of some form of heart disease. Nandyan din ang stress, drinking too much alcohol, and of course, the diet and the nutrition, because a healthy diet is one of the best weapons that you have to fight cardiovascular disease. So what you eat and how much can affect other controllable risk factors such as your cholesterol, your blood pressure, your diabetes, and also being overweight. So next, you have to know the symptoms of cardiovascular disease. Okay. So for example, you have this scenario. There is a person who have a sharp pain on the left side of the chest, profusely sweating, nanglalabo ang paningin, nahihilo. These are all symptoms that can point to one thing, which is heart attack. However, we have to remember that not all heart problems come with warning signs. So despite being a growing concern, most of us are unaware of the signs and symptoms that can put you at risk of heart failure. So madaming pasyente, pag tinanong mo, wala naman daw nararamdaman, wala akong any symptoms that can be related to heart disease. But we should know that chest pain is not the only symptom of heart disease. Okay, so now the question is, what are the symptoms that needed to be addressed to keep the heart disease at bay? So number one is chest discomfort. So, ang tatanungin sa mga pasyente, do you often feel slight discomfort in your chest? If meron, it could be a warning of heart disease. Pwede siyang pinching, burning sensation, tightness, or pressure in the chest. But we have to remember na hindi naman din automatic sakit na agad yun sa puso, because it can still be secondary to other diseases like your GERD or the gastroesophageal reflux disease. Na very common sa mga younger individuals, also costochondritis or the muscle pain in the chest wall. Pero hindi pa rin natin ito dapat baliwalain at dapat magkonsulta kung kinakailangan. Kapag palaging nakakaramdam ng nahihilo, lightheaded, throat or jaw pain, especially if you feel the pain or the pressure in the chest that spreads up to your jaw, or throat, it could be a red flag. Look out also for nausea, indigestion, because this can be warning signs of a heart attack. And women are more likely to show these symptoms than men. Snoring. The concern starts when the snoring gets unusually loud, which may sound like gasping or choking, because this can be a sign of sleep apnea, and it can put extra stress on your heart. Sweating profusely. So along with chest discomfort, if you find yourself na biglang pinapawisan ng malamig ng walang dahilan, then that could be another warning sign of a heart attack. Pain that spreads to the arm. So halos lahat sa atin, alam natin yung classic heart attack symptom where the pain radiates down to the left side of the body. Madaling mapagod. If you have this symptom, then it's time for another health checkup, because sudden exhaustion or unexplained weakness needs immediate action and can be a symptom of heart disease. Swollen legs, feet, and ankles. So kapag nagmamanas, this can be a sign of heart failure. And lastly, if you feel that your heartbeat is irregular, then this could be an arrhythmia and you need to consult. So if you have any of those symptoms or the risk factors mentioned, then it is time to consult your doctor for diagnosis and management. And if you think you might be having a heart attack, immediately call emergency help or go to the nearest emergency room. Because heart disease is easier to treat when detected early. So talk to your doctor about your concerns regarding your heart health and how to reduce the heart disease risk. Okay. And lastly, you have to follow the tips on how to strengthen the heart. So although it may look simple, sasabihin lang sa'yo, kumain ka kasi ng tama, mag-workout ka, mag-exercise, quit smoking, and don't stress. But if you are like most of us, then it isn't so simple to put these goals into action. That's why I am here along with your doctors to help you and get the practicality straight and help you lead a healthy lifestyle. Okay. So, first and foremost, you have to get moving because heart disease is mostly preventable by changing your lifestyle and managing the risk factors. Because a healthy heart is the one that gets exercise. Napaka-importante ng physical activity. The American Heart Association recommends at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week for good heart health. So, yung 150, hindi naman kailangan na isang bagsakan na 150 minutes na exercise, no? You can do at least 30 minutes, at least 5 times a week, 5 days a week, or you can do vigorous exercise, total of 75 minutes. So, kahit na 25 minutes lang, at least 3 times a day, para ma-complete natin yung recommended ng American Heart Association. So ano-ano ba yung mga activities na considered as moderate? Nandyan yung walking, so kahit walking lang, gardening, hiking, dancing, cycling, usong-usong ngayon yung pagbabike. So all of these are considered moderate exercise and you can do to keep your heart healthy. Ano ba yung mga benefits ng regular exercise? So aside from decreasing the all-cause mortality by 30% and decreasing cardiovascular disease by a huge 35%, maaari din niyang maiwasan ang mga risk para magkaroon ng diabetes, colon and breast cancer, dementia, hip fractures, and even depression. Next is smoking. This is the leading cause of preventable death in the United States. So, ang daming harmful effects ng smoking as you can see in this illustration. And for a healthier heart, do not smoke and avoid secondhand smoke. Okay. So, next is obesity. This is defined in adult Asians as having a body mass index equal or greater than 25 kilograms per meter squared, which increases the risk for multiple chronic conditions. So you have to achieve and maintain a healthy weight because maintaining a healthy weight can reduce the risk of heart disease and other health problems. Paano ba natin malalaman yung BMI natin? Very easy, no? So sa Google lang, madami kayong makikita na BMI calculator. Kailangan nyo lang alamin kung ano ang weight and also ang height nyo to get your BMI. So, ang normal na BMI should be 18.5 to 22.9. And again, kapag ka-obese, it is BMI of greater than 25 kilograms per meter squared. Okay. So, next is the diet. Ang pinakamahirap gawin at i-control, especially ngayon na madami nang naka-work from home nung pandemic, 'di ba? Palaging nasa bahay. Ang sarap mag-order, napaka-accessible ng mga Grab food. So number 1 is you have to eat fruits and vegetables. So very nutritious ang berries, citrus fruits, bananas, etc. And yung mga green leafy vegetables, no? Eat a variety of grain products every day. So include the whole grain food that have lots of fiber and nutrients. So examples ng mga whole grain, yung mga oatmeal, whole wheat bread, also brown rice. Then you have to eat fish at least 2 times a week. So yung mga oily fish, ito yung maraming omega-3 fatty acids. These are best for your heart. So this would include yung mga salmon, sardines, cod, mackerel, herring. And you have to limit your saturated fat and cholesterol. So para magawa mo yan, dapat piliin mo yung mga lean meats or yung mga meat alternative like beans or tofu, and then non-fat and low-fat dairy products. Piliin din natin yung mga polyunsaturated or monounsaturated fats like canola and olive oil to replace yung mga saturated fats such as butter. So basta saturated fat, tandaan natin ito ay masama, nakakapagpataas yan ng ating cholesterol at hindi maganda para sa ating puso. Okay. Ugaliin natin na magbasa ng mga food labels kapag may binibili tayo sa grocery. And again, limit the trans fat or the saturated fat that you eat because it will raise the levels of the LDL and lowers the HDL or the good cholesterol in the blood. At yung mga trans fat na yan, makikita yan sa maraming mga processed food, including mga cookies, mga chichirya, crackers, chips. Okay. So you have to choose healthy fats. So unsaturated fats like olive, canola, corn, sunflower oils are part of a healthy diet. But we have to remember that all fats are still high in calories, so you have to watch your serving sizes. Limit the salt. So try to limit the sodium that you eat to less than 2,300 milligrams or 1 teaspoon only. So imagine, dapat 1 teaspoon lang ng asin ang kakainin mo sa isang buong araw na. And this can help lower your blood pressure. Kapag ikaw ay meron ng high blood, meron ng sakit sa puso, dapat mas mababa pa, 1,500 milligram a day na lang of sodium na dapat i-consume to lower the blood pressure even more. Okay. Eat only as many calories as you need to stay at a healthy weight. So limit drinks with added sugar. Wag na tayong mag-soft drinks, milk tea, frappuccino, or yung mga powder juices. Punong-puno yan ng asukal. Ganon din yung 3-in-1 na mga kape. Palagi ko yung sinasabi sa mga pasyente ko, these are very high in sugar. And if you drink our alcohol, you have to drink in moderation and also limit the added sugar. Okay. So how do you monitor your blood pressure? So this is very important, lalo ngayon na uso na palagi na mga pasyente natin naka-digital na blood pressure monitoring na. So from the International Society of Hypertension, the normal blood pressure should be less than 130/85. Kapag ang BP nyo nakikita nyo na more than this normal level, please consult your doctor, consult your cardiologist para malaman kung kailangan na ba tayong mag-start ng gamot or makukuha pa natin ito sa mga lifestyle modifications. So this is the proper way to get your blood pressure, no? So dapat itong BP cuff should be placed at the mid-arm and at heart level. So ang best time, this is a very common question, best time to get your blood pressure should be 30 minutes after waking up. So hindi dapat kukuha ng BP pagkagising na pagkagising dahil mataas talaga ang BP. This is the normal circadian rhythm na mataas ang blood pressure natin immediately after waking up. So you have to wait at least 30 minutes before you get your blood pressure. And yung unang blood pressure na makukuha nyo, you disregard that because that is also usually high. And then the second and the third blood pressure taken at 1 minute interval, i-average, no? And that is your more accurate blood pressure. Okay. Next is the high blood cholesterol. Kailangan palagi din natin i-check ang ating mga lipid profile. Because high levels of bad cholesterol also threaten the health of your heart. So again, limit the amount of food that contain the saturated fats, which can increase your cholesterol. And this would include butter, fatty meats, and full-fat dairy products. Instead, support your diet with food that can naturally lower your cholesterol. Okay. So how can you increase your HDL or good cholesterol? Sa mga Filipinos, very common na bababa ang HDL or good cholesterol. So your diet should include olive oil, soy, beans, nuts, flaxseed, chia seeds, avocado, apple, and also whole grains. So this food can increase your good cholesterol. And ano naman yung mga dapat iwasan para hindi tumaas ang ating triglycerides. So dapat bawasan ang sugar, refined grain or starchy foods, high calorie foods, so yan like your donuts and your pizza. And again, iwasan ang mga saturated and trans fat. Okay, so we have to also remember that we have to manage our stress. And managing your stress doesn't mean kailangan 12 hours of daily yoga and meditation, no? Just taking like 10 minutes a day to focus on yourself and your breathing can do the trick. Because research shows that the effects of stress can manifest throughout the body, including your heart, affecting your blood pressure, affecting your cholesterol levels. And it can also encourage unhealthy coping habits, such as drinking and smoking, which can further damage the heart. So you have to slow down, you have to pray, you have to meditate, because we have to remember that mental health is as important as your physical health. And managing stress in a healthy way can also protect your heart. So, okay. So through some lifestyle and nutrition changes, you can be a victor and not a victim in the battle against heart disease. So I would like to end my slide with this proverb. I hope that you will remember this because this can guide us in making our lives better, making our heart healthier. So the secret to living well and longer is to eat half, walk double, laugh triple, and love without measure. Thank you very much.
Thank you, Dr. Aileen, for your very informative, practical lecture on how to prevent heart disease. So we'll now start off. By the way, we will ask our audience and followers, even from the Facebook Live, you could send in your questions, clarifications, comments tungkol dun sa topic natin for today. Kasi napaka-practical niya. We encounter this in our daily lives, even in our practice. So for our first question, Dr. Aileen, may question si Sir Red Mendoza. Good day. May mga kumakalat na news na ang mga taba daw ng pork and beef ay hindi naman daw nakaka-affect sa katawan and they are considered as good fats. Can we get a clarification on this, Doctor? Thank you, Sir Red, for your question.
Okay, thank you for that question, no, Sir Red. Okay. To be honest po, hindi ko narinig yung news na yon na meron na palang kumakalat na news na healthy, no? Ang sinasabi good fats yung mga taba ng pork at saka beef. Okay. So as I have mentioned in my slides, we have to avoid yung mga saturated at saka trans fats. So kasama doon, hindi talaga healthy ang mga taba ng pork and chicken, ay taba ng pork and beef, because this can increase the lipid profile levels, especially the total cholesterol and also the LDL or the bad cholesterol. So as cardiologists, as physicians, we are still advocating a healthy diet, and mas gusto natin yung mga lean meats because these are healthier. Also yung mga meat, even yung mga meat alternatives, like as I have mentioned, like yung mga tofu, mga beans, no? And then non-fat and low-fat dairy products. So hindi po totoo na healthy good fats yung mga taba ng pork and beef, no? So this can still increase the cholesterol levels and also increase the risk of cardiovascular disease.
Siguro, doktora, may ari yan ng mga eat all you can, sangyup, salamat.
Pwede.
Kasi ngayon, di ba, I mean, eat all you can, buffet. Yan
Yes.
talaga ang natin ngayon sa Philippines, no? So, Dr. I'll give you another set of questions, no? So,
Okay.
there a certain age wherein screening for heart disease should be done. Like, di ba, sa colon cancer, 40 and above, sa cardiac disease pa. Kasi lalo na ngayon, we've been seeing younger people having heart attacks. So what is your take on this?
Okay. So, for cardiovascular disease, wala po talagang specific na age na dapat nasasabihin na dapat mag-executive check-up na or dapat magpa-test na ng laboratories. From my slide also, ang pinakauna doon is understand your risk. So, depende sa mga risk factors mo. If you have, lalong-lalo na po yung mga major risk factors na meron ka na talaga na you cannot change, like yung heredity, like yung parents mo, merong cardiovascular disease or died of cardiovascular disease, then that's put you at an increased risk for cardiovascular disease, no? Merong certain race and also yung increasing age. So kapag meron ka ng mga risk factors, hindi ka dapat mag-antay na kailangan 60 years old ka pa, 50 years old before ka mag-start na mag-consult and do the laboratories. So if you have these risk factors, as early as, ang sinasabi natin is 40 years old eh. So dapat magpapa-check up na and then check all the laboratories. At least know your blood pressure. Kasi usually most of the patients who have high blood pressure also have dyslipidemia or elevated cholesterol. And kapag yung mga may elevated cholesterol din naman, most of them will have hypertension or other diseases. So kailangan general check-up. Kapag meron kang simptomas, kahit na anong edad mo pa, dapat magpa-consult ka din and magpa-laboratories, executive check-up para malaman mo kung ano yung symptoms mo. So we do not give a specific age for you to start looking at your heart health. So kahit na anong edad, especially if you have the risk factors, then already start consulting your doctor.
Okay, may related question dito from Mr. Noel Abuel. Good morning po. Ask ko lang, what are the age in the Philippines? Siguro ito yung mga epidemiologic or age ranges ng Philippines daw na may heart disease. Anong ranges? For example, siguro mas marami sa gantong Meron ba tayong data niya, Dr. Aileen?
Kasi ang data lang na meron po tayo is that most cardiovascular deaths occur at 65 years and above, no? Pero yung specific po na edad, kung I do not know of any po na meron tayong specific age na kung saan nagkakaroon ng kaso ng heart disease. Lagi lang natin sinasabi, of course, the older the person gets, mas nagkakaroon sila ng cardiovascular diseases. Pero ayun nga po, na-mention ko din, 1/3 of people who die prematurely of cardiovascular disease are less than 70 years old din. So wala talagang pinipili ang cardiovascular disease.
So wala talaga tayong data na majority sa Philippines are of age na 40 and above. Wala pa talagang tayo. It's just the death na commonly occurs 65 and above. Yun yung may data tayo. Okay. So yung doktora, may gusto tayo i-clarify kasi minsan, even in my clinical practice, may mga nalilito na parang hindi nagpatingin. Hindi, doktora, hindi ako, kaya sabihin mo sa kanila, high blood ka po. Ay, hindi po ako high blood. Kasi nagpapit ako ng cholesterol ko, okay naman po. So parang nalilito sila dun sa mga interplay ng factors. So siguro, doktora, let's emphasize on that. Kasi ganun-ganun eh. Pag nakita nilang, kasi di ba minsan wala naman blood pressure, nagpapalab lang. Pag nakita na nilang normal ang cholesterol levels nila, sasabihin naman nila agad na hindi naman sila high blood. O kaya baliktad. Pag mataas yung cholesterol, i-insist naman nila na uminom ng gamot sa high blood. So kailangan nating i-clarify yan yung differences. Meron pang mga common misconceptions na pag anemic,
yes.
Parang bakit amo ako sasabihin na high blood po ako? Anemic nga po ako, ang hemoglobin ko. Yan. Siguro let's tackle on those kahit 3 or 4 liners, Dr.
Okay. Tama ka, Doc Ginger, no? Lagi ko din yung naririnig sa patients ko. Sasabihin ko, high blood ka ba? Sabihin, hindi, anemic nga po ako, Doc, Kaya, imposible. So, laging kailangan maintindihan ng audience po natin na unang-una muna yung hypertension and anemia. These are two very different factors po. Pag sinabi na anemia, ang concern lang nito is the hemoglobin level, no? So wala pong kinalaman sa blood pressure. So pwede kang anemic pero high blood ka. Pwede ka rin naman na normal yung hemoglobin mo tapos mataas ang hemoglobin mo, so normal ang hemoglobin mo, pero ang blood pressure mo naman mataas. So magkaiba sila, no? Okay. So kapag hypertension, marami din tayo, Doc Ginger, kahit na nagbi-BP sila, hindi nila alam kung ano yung normal na blood pressure. So again, I would like to emphasize that the normal blood pressure should be less than 130/85. At hindi rin ang isang misconception din ng mga tao, sabihin nila, 140, Doc, pero okay pa naman, di ba, kasi matanda na ako. 150, pero 60 years old na ako so okay na yung blood pressure na yon. So in the latest studies, in the latest guidelines, the blood pressure should be less than 130/85. There are only certain conditions na pwede hanggang 140, pero you have to consult your doctor na. So kapag ka 140 and above ka na, dapat mag-start ka ng mag-consult para malaman mo kung hypertension ka ba and kailangan mo bang mag-take ng medications for your hypertension, no? So ang BP again should be less than 130/85. Yun ang normal from the International Society of Hypertension, and this is the latest guidelines released just last May 2020, no? Ano ba yung isang pinapa-clarify natin?
Cholesterol.
Sa cholesterol. Okay.
Pag naman, parang masyado nila na pagdidikit yung dalawa.
Okay.
So sige.
Okay, so sa literature po, hypertensive patients, 50% of them have dyslipidemia or elevated cholesterol. And sa dyslipidemia naman, ganun din, 50% of them have hypertension. So hindi naman automatic na magkasama yung dalawa, but very common. Meron nga tayong tinatawag na, Doc, na lipitension. So ito yung bago na combined disease of hypertension and elevated cholesterol. So kapag meron kang hypertension, dapat mag-check ka din talaga pa rin ng mga cholesterol levels kasi nga very common sila to occur. Pero hindi porke normal ang blood pressure mo ay ibig sabihin normal na ang cholesterol mo, at hindi porke normal ang cholesterol mo ay ibig sabihin normal na yung blood pressure mo. Separate, different entities pa din sila na kailangan parehong i-check. And iba ang management ng bawat isa sa kanila. So iba ang gamot para sa high blood, iba rin ang gamot para sa cholesterol levels.
Okay,
so,
another timely question na usong-uso. Can you comment on the role of ketogenic diet and intermittent fasting as a way of controlling weight?
Okay.
Kasi yan, Doktora.
Very, tama, very common and controversial din kasi iba-iba yung pananaw ng mga tao, even doctors regarding this. So unahin ko po yung ketogenic diet. So ang ketogenic diet, ito po ay kalaban talaga ng mga cardiologist. Okay? So lalong-lalo na yung mga ketogenic diet na talagang hardcore keto diet. So ito yung kumakain talaga ng chicharon, kumakain ng taba kasi 'di ba yun ang paraan para mag-lose ng weight. So hindi kumakain ng mga carbs, pinapalitan nila ng mga matatabang pagkain. So, ang ketogenic diet ay hindi nire-recommend ng mga cardiologists because as I have mentioned, ito ay source ng mga trans-insaturated fat which can increase the cholesterol levels and also increase the risk for cardiovascular disease. So totoo, kahit na totoo po na ang ketogenic diet nakakapag-lose ng weight, kaya nga talagang nagiging uso siya at nagugustuhan ng mga tao, lalong-lalo na ng mga nagka-crash diet. Kasi to be honest, very effective po siya in losing weight. But hindi lang naman kasi pag-lose ng weight yung iniintindi natin, we have to also take care of the heart. And when you eat all those trans and saturated fat, hindi po nagiging healthy sa puso. So, hindi namin nire-recommend ang ketogenic diet. For intermittent fasting, meron na pong mga studies na ginawa dito. Even the CPG or the clinical practice guidelines, this can be recommended to a certain age at kung wala pong mga risk factors. Because ang intermittent fasting can really help in losing weight and hindi siya nakaka-harm naman sa ating mga puso, no? So merong healthy way of intermittent fasting, and this can be a good start para makapag-lose ng weight, and this is preferable compared to your ketogenic diet.
Okay, so very clear. No, hindi porke effective sa certain area na to, no, doktora, o kaya minsan kasi tingin natin agad effective kasi we lost weight, pero hindi natin long-term effects nitong diet na ano. So talagang maganda talaga balance, no? Everything in balance pag nagda-diet tayo. So yung nga may follow-up comment si Sir Noel Abuel kanina na kaya niya tinatanong yung age kasi nga napapansin nila kulang daw ng exercise ngayon yung mga bata, no? Lalo na nung panahon ng COVID.
Puro social media na lang kasi, doktora.
Bata, tapos work, school, virtual schooling, wala nang PE, no? Napansin natin wala nang physical, exam na physical education ng mga bata, yung mga anak natin sa siguro naapektuhan din yung ganon. Kaya nag-comment si Sir Noel about that. Siguro, doktora, yung sapat 2 to 3 more questions. A very interesting topic to. Marami tayong natututunan. Even ako, as a doctor, ang dami ko pa rin, doktora, natututunan sa inyo regarding this and how to educate my patients. Siguro, doktora, knowing that the Philippines, hindi naman tayo ganong kayaman na bansa, no? So, ano ba yung mga basic test na kailangan nating ipagawa sa mga pasyente natin, lalo na kung meron silang risk factors?
Okay. So, if you have the risk factors, no, ang unang-una is kailangan talaga po ng consult, no? Kailangan ma-check yung blood pressure. Dapat makasigurado tayo na our blood pressure is still within the normal range. And then for the basic laboratories, ang importante talaga na malaman natin is yung mga iba pang risk factors na pwedeng makapag-aggravate ng cardiovascular disease. So, una yung lipid profile. So, kailangan kompleto, no? Yung ibang test kasi, doktora, total cholesterol lang. But very important yung lipid profile kasi among the 4, we have to really know the LDL level kasi yun po yung pinaka important and is the risk factor to develop cardiovascular disease later on. So, dapat alam natin ang LDL levels natin. So, yung lipid profile, cholesterol, triglyceride, LDL, and HDL. And then, we also have to know our sugar. Kailangan na malaman natin kung diabetics na ba tayo or hindi, because this can also lead to cardiovascular disease if elevated. At dapat, sinabi ko paulit-ulit, no, na very easy to manage kapag ka na-detect ng early. So, kailangan malaman natin yung sa sugar. We also have to know the creatinine levels, yung kidney function, para malaman natin kung may risk factor ka, nagkaroon na ba ng complication sa kidney, kung meron na bang kailangan gawin din para sa ibang parts ng ating katawan. We also have to know the SGPT or the liver enzyme, kasi yung mga ibang medications natin, especially for the cholesterol levels, nakadepende din kung okay ba ang SGPT natin or the liver. And of course, nandiyan din yung very common natin na CBC. We have to know at least our hemoglobin levels and ECG. No? Kasi yun din, at least may baseline tayo, lalong-lalo na kung meron na tayong hypertension, dyslipidemia, or symptoms, risk factors, dapat alam natin yung ating baseline na ECG.
Okay.
So yun lang naman, Doc, yung mga baseline na kailangan makita natin sa isang patient.
Siguro ang next question, I don't know if alam mo na you could answer this, no? Kunwari po yung mga pasyente nating hindi naman may kaya, no? So can they access this through their barangay health clinics? Meron na ba tayong ganyang programa or may mga DOH programs? Are you aware of anything?
Meron akong mga pasyente, Doc, na kapag dumating sila sa mga center or yung mga programs for senior citizens, meron din na ginagawa nila yung basic na test. Unfortunately, Doktora, most of them kulang pa din. So, kailangan mapakita nila yun sa mga doktor nila. And kung meron mga additional test na kailangan, at least mapapagawa, nakabawas na rin kahit papano.
Okay. So, next question. Doktora, can you comment on the effect of COVID on the heart? Kasi maraming pasyente ngayon ang nagka-COVID, no? Or natatakot magpabakuna kasi sinasabi, di ba, increased risk of thrombosis, naku, aatakihin ka dyan, either heart attack or stroke. Pwede ko bang mag-comment regarding these two things, yung long-term effect ng ating puso at pangalawa, yung bakuna?
Okay. So, unang-una sa lahat, yung mga tao ngayon, 'di ba po, medyo hindi na masyadong natatakot sa COVID kasi mild na lang daw, no, yung Omicron lalo. Pero we always emphasize na even if the COVID now has milder symptoms, which is totoo naman po, hindi natin gugustuhin pa rin dapat na magkaroon tayo ng COVID, lalong-lalo na if we already have the risk factors for cardiovascular disease. Kasi alam po natin ang COVID, it can lead to blood clots, very prone to blood clots. So ayaw natin ng complications of COVID, especially to the people who have cardiovascular disease. So ang COVID, pwede yan makapag-cause pa din ng tinatawag na myocarditis or inflammation sa puso. Pwedeng magkaroon pa din ng heart failure and also yung mga arrhythmias. So, napaka-importante pa din, of course, na we have the vaccine at pati yung booster po, no? Because we do not want to add additional burden sa puso natin kapag nagkaroon tayo ng COVID. And with these vaccines, mas maiiwasan natin yung mga complications na yun sa puso. Ang dami din nagsasabi, Doktora, na nagkakaroon sila ng problema sa puso, nagkaroon ng high blood, nagkaroon ng arrhythmia, irregular ng puso, nag-chest pain sila simula nang magpabakuna. So lahat po yan ay hindi totoo, no? Until now, madami ng studies ang ginawa, ilang years na, pero walang any proven correlation of the vaccine na magkakaroon ka ng problema sa puso. And in fact, baliktad, it can be protective of the heart. So,
very clear.
Huwag tayong maniwala sa mga marites.
Very clear. So it's really time to back up, di ba? Yan ang ating advocacy sa PCP, ang back up. Hindi na enough lang yung complete vaccination at 2 doses. Hindi na po yan ngayon. Kailangan meron po
booster doses
to be fully protected from COVID infection. So may last na to, Doktora. Ang dami kasi
no problem.
Questions no? Should we test for ApoB? A question for Sir Erwin Espinosa. Should we test for ApoB?
ApoB, okay. This is not a very common test po, no? Yung apolipoprotein B, okay? So, ginagawa lang to dahil ito yung nagko-correspond sa elevated levels of LDL, yung bad cholesterol, and associated siya sa increased risk of cardiovascular disease. To be honest, sir, hindi tayo nagpapagawa niyan routinely. And even in patients who have elevated cholesterol, ako, to be honest po, in my practice, wala pa yata akong na-requestan ng ApoB sa mga patients ko. So, para sa akin, enough na yung lipid profile. And kapag nakita ko na mataas yung LDL, then I will already start treating the patient for the elevated LDL. Hindi na ako magpapagawa ng ApoB.
Okay. So with that, thank you, Doctora, for this very fruitful, very informative discussion on heart disease. Mag-i-invite ka pala regarding the activities for the World Heart Day.
Okay.
The floor, Dr.
Yes po. Okay. So, may slides ba tayo, Doktora?
Gilbert, can you share the poster? Yan po.
Okay. So, from the Philippine Heart Association, Philippine College of Cardiology, gusto ko pong i-invite lahat na sana po maka-attend ng Usapang Puso sa Puso. This is the World Heart Day 2022 celebration namin on September 29, 10 to 12 noon po, no? So, makikita mo yan sa Facebook Live po sa Philippine Heart Association. So, maganda po, sana maka-attend po kayo because it will also give the audience lectures about healthy eating, and then yan tungkol sa smoking and vaping para malaman ng lahat kung ano ba yung mga myths and facts about smoking and vaping. And we have this special guest po. So I hope everyone can attend this World Heart Day celebration of the PHA. Thank you.
So unlimited access siya, Dr. Aileen?
Yes po. Opo.
Kasi siya virtual, they can just log in your Facebook page. Tama ba?
Tama po. Yes.
Okay. So kita tayo doon. So know and learn more about heart disease, know your risk factors, at so we could promote a very healthy heart in our lives. So Dr. Aileen, any last message to our viewers, our followers, our listeners?
Okay. So again, Dr. Ginger, I would like to thank the PCP for inviting me to be the speaker for this lay webinar. And I hope I was able to impart to the audience the impact of cardiovascular diseases, and most importantly, the ways to have a healthier heart. So sana po lagi nilang maisip na kailangan pangalagaan ang kalusugan, pangalagaan din ang ating mga puso, and we have to start early. Thank you very much.
Thank you. Hanggang sa muli, Dr. Aileen.
Thank you.
Thank you so much. So before we end this morning session, lay forum, may I call on the Board of Regents, Dr. Regina, to give us the closing remarks.
Hello po. So in behalf of the Board of Regents of the Philippine College of Physicians, I would really want to thank our expert speaker, internist cardiologist, Dr. Aileen Albania Tamargo. Marami po tayo talagang natutunan how to improve heart health, at na-invite pa po tayo lahat. Don't forget, World Heart Day on September 29, 10 to 12. Meron tayong open invitation from the Philippine Heart Association. Naturo niya sa atin na liwanagan tayo ulit na ito palang sakit sa puso, kahit ito ang number 1 cause of death globally at saka dito sa Pilipinas, 30% of all deaths ay dahil sa sakit ng puso. Pwede palang maiwasan ang sakit sa puso sa pamamaraan ng healthy lifestyle. So yung 4 steps na sinabi ni Doktora, don't forget, number 1, alamin ang ating heart, ating risk factors. Number 2, know the signs and symptoms of heart disease. Number 3, consult a cardiologist early and correct misconceptions. And number 4, follow the tips to strengthen your heart. At wag na maghintay na matagal, wag na maghintay na tayo tumanda. Now is the best time to do it. And yung last slide ni Doktora, yung eat half, walk double, laugh triple, and love without measure. Parang love unlimited yun, So, napakaganda po ng naging talakayan natin today. Salamat po rin sa lahat ng ating media partners as well as our frequent viewers and followers. And finally, gusto ko rin pong bigyan ng parangal si Dr. Ginger Litap Samonte for her fantastic hosting and all the technical support from the PCP. Marami pong salamat sa ating lahat. Thank you.
Thank you, Doktora. Thank you sa PCP, sa Board of Regents, with the presidency of Dr. Payawal for her support to our committee. Maraming salamat. At syempre sa mga viewers, followers, yung ating mga talagang sumusunod na tumututok linggo-linggo, hindi na nga linggo-linggo, minsan twice a week na nga tayo nagkaka-live forum, pero nandyan pa rin kayo na nakikinig sa amin. Maraming salamat. So ito po si Dr. Ginger Samonte na nagpapasalamat muli sa inyong pakikinig. Don't forget to follow us in our social media accounts through Facebook. We have our YouTube, we have our Twitter, we have our Instagram, and also we would like to invite our members to attend the PCP Mid-Year. Nilbert, paki-post na lang yung poster natin so that they can look at the details. We'd like to see each other sa Subic Bay. Face-to-face na po to. Magkikita-kita tayo mga kaibigan, mga kasama sa PCP. At may limited Zoom lang po. So kung may oras po, ito na po ang panahon na tayo ay magkikita-kita. Siyempre may pag-iingat pa rin naman. Hindi naman tayo basta lang pupunta doon ng walang pag-iingat. So we'll see each other in PCP November 2022 in Subic Bay. So mula uli sa Committee on Media and Lay Forum, maraming salamat, and we will be expecting you to attend in another lay forum sa Tuesday. Ang topic naman po natin ay isa pang makabuluhan at very timely topic on arsenic poisoning, no? So maraming salamat mula sa PCP. Stay safe and take care. Maraming salamat.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.